Hey, how's it going everybody? Dr. Matt here at ZPT, and in this video I'm going to show you how to take some tension off your front of your knee by working on the big robust quad muscles from the top down. Okay. Now, why are we doing this? All right. What we know is that the tighter the tissues are upstream, the more compressive force we're going to down over the top of that kneecap. So what we're going to do is we're going to attack the 3 inches just above the kneecap in the quad, and then we're going to come up to the top of the hip here, just below your hip pointer bone, which is also known as your ASIS, and working the bottom 3 inches here. Okay. So what we're going to do is we're going to grab a barbell. If you don't have a barbell, I'm going to show you guys how to use a foam roller or a PVC pipe to get the same effect. Okay. What we're going to do is put the barbell right on top of the quadriceps, just above the kneecap here. Now, you could just lay the weight of the barbell down, or if you want to add a little more pressure, because you're sick like me, you can put your leg down or even put your hands down on top to create that extra effect. Now, what I want you to do is a couple things. You could either just pressure wave it up and down, slowly moving the barbell those 3 inches up in the quad, back down to the kneecap. If you find a tender spot, you can perform what's called a contract-relax technique. So you can try and squeeze that muscle and then relax it out and start to move that leg around back and forth. Pressure wave the barbell up and down again. Doesn't matter. I want you guys to free form, okay? Do what works for you. Now, the next piece is you're going to move back up to the hip flexor area in the quadriceps. Once again, pushing that barbell down with some extra pressure. I like to squeeze and contract, relax here. Hold it for a few seconds. Relax, move the leg around. Pressure wave the barbell up and down. Okay. And I want you to spend about 2 minutes minimum above the knee and the 3 inches right below the hip. Now, if you don't have the barbell, we could work with a foam roller or a thick piece of PVC pipe, just like this. Okay. What we're going to do, same thing, start at that 3 inches just above the knee, laying down on top of it, using the weight of your body this time. And you can do the same thing. Slowly move back and forth, side to side. Try and squeeze and straighten the knee, contract that quad muscle, and then relax. Once again, move it back and forth. The other thing you could do here, it's different from with just the barbell, you can bend your knee and try and stretch those quad muscles over some compressive force of the PVC pipe. Okay? After this, spending 2 minutes once again on those 3 inches above the knee and 3 inches below the hip, I actually want you to get into some kind of a active stretch. Okay? So we're going to work on improving knee flexion or hip extension. All right, a good way to do this is get yourself something to protect your knee and get into a lunge position. Now, there's a couple points that you have to take away from this, is that you need to be able to keep your spine neutral. So you need to keep your rib cage down and your butt squeezed. From here, the leg can come out in front, rib cage down, butt squeezed, and I want you to drive those hips down towards the floor. Okay? You should feel a nice big stretch either through the top of the hip or in the bottom of the quad, depending on where your limiting factor is. All right. Same thing. I want you to spend at least 2 minutes staying active in this position. After this, I want you to get down into the bottom of the squat and see how it feels. Hopefully, you checked out your squat beforehand. You kind of felt how stiff you were, and then you'll notice a difference after performing these mobilizations. Thank you.